Good afternoon, everyone, and welcome to the Policy for Shared Prosperity series with Ideas42. I'm Mitra Salasel, Director of Communications here at Ideas42, and on behalf of all of us on the team, I'd like to thank you for joining us for the inaugural installment of our newest series, examining the ways behavioral insights can inform better policy at all levels in the United States. To kick off this new series, I'm pleased to introduce a conversation about Ideas42's new policy lab and some of our work to date, featuring our own Kelly Garcia, Amanda Kaplan, and Jeremy Borofsky. Just quickly, a little bit about our panel today. Kelly Garcia is the Director of Policy at Ideas42. She has more than 10 years of policy experience working to advance access to healthcare, reproductive rights and justice, economic justice, and immigrant justice. She holds a JD from Yale Law and a PhD in social psychology from UCLA. Also joining us is Jeremy Borofsky. He's Vice President of Applied Research and Evaluation. Previously a fellow at Brookings, his work has appeared in publications such as the Journal of Health Economics, The Lancet, and Health Affairs. He has a PhD from Harvard's Chan School of Public Health. And finally, we're joined by Amanda Kaplan, She's an associate at Ideas42, also on our policy team, and she has experience on the US Senate Committee on Rules and Administration with a focus on federal voting rights legislation. So before I hand it over to Kelly to provide an overview of our policy lab and kick off the rest of the program, just a brief kind of housekeeping note for each of you who are joining us that may be new to Ideas42's events programming. We'll be including plenty of time for questions at the second half of this conversation, but we'll be taking them via the Zoom Q&A box at the bottom of your screen. As the questions occur to you, please go ahead and drop them into the box at the bottom of your screen, and we'll share them with our panel in the second half of the hour. Right, I believe that is everything. So without further ado, over to you, Kelly.
Thank you, Mitra, and thank you everyone who is joining us for, as Mitra said, our inaugural event. We are really excited to have you. I'm going to briefly go over our agenda for today. First, I'm going to talk about the policy lab and the work that we've been doing. Then turn it over to Jeremy and Amanda to give some examples of our work. And finally, we will end with the Q&A. So I think most of you are familiar with Ideas42, but our primary goal is to take insights from the behavioral sciences and use them to create evidence-based solutions that will improve people's lives. So the Policy Lab was launched about a year ago to help us broaden the scope of our work and move behavioral science more directly into policymaking. At the Policy Lab, we apply insights from behavioral science to advance public policies that promote equity and well-being for everyone, but with a real focus on those policies that are most important for people experiencing poverty, Black, Brown, and Indigenous people, people with disabilities, and people from communities that have faced historic discrimination. We are working towards a more just and equitable world, one where people have the resources they need, and not just the economic resources, but also the political and social capital necessary to lead lives with dignity and autonomy. We have identified a few core values for what it means to do this work. First, optimism. We let our vision of a more equitable and just world guide us. All of our work is in the service of that goal, and that keeps us optimistic because we are working towards a better world. Second, collaboration. We are new to policy work. We know that there are already lots of people and organizations with deep expertise and experience who've been doing this work for a long time. We are not here to reinvent any wheels. Instead, we want to help bridge the gap between research and policy. And so with that, we plan to collaborate with existing coalitions, with existing advocates and people on the ground, as well as behavioral scientists to advance our goals. My colleagues are going to provide some specific examples of how we've done this. Third, we practice patience. This is often my mantra, particularly when I'm standing in line. I am practicing patience, but it's also a good thing to keep in mind as we're doing policy work. Policy work is just slow. particularly in this polarized climate. There can be years and years where you're pushing for a reform or a new law or a change, and nothing happens, or you're moving really slowly, and then suddenly there can be a lot of movement and action and things move really quickly. So we always have to think about the long game. We can take as an example the Pregnant Workers Fairness Act. So this bill would require employers to provide accommodations for pregnant people. It was first introduced in 2012. It gets reintroduced every single year, and every year there's a little bit more progress. There might be a few more co-sponsors, there's more conversation about it, we talk about it, it gets into the air and thinking about what pregnancy accommodations should look like. At the same time, as people have been pushing for it at the federal level, advocates at the states have been working to push states to enact similar laws. And 31 states, at least 31 states, now have pregnancy accommodation laws on the books. So this is the approach that the Policy Lab will take. It's a focus on moving policies at all levels of government while remembering that slow and steady wins the race. Fourth, we prioritize equity. We choose our priorities, analyze our work, think about the words we choose from the perspective of, will this advance equity? And finally, we seek to center lived experience. This is an ongoing goal for us, and we will try to do this in a variety of ways. But the bottom line is, I can sit here in my office and come up with policy ideas that are behaviorally sound, but also that don't actually improve the lives of the people who we are trying to help or the people that the policy affects. So whether through collaborations or research or other avenues, we are building in ways to make sure that we are addressing people's real world needs and creating space for people with lived experiences to just be able to take the mic. Of course, the goal of the Policy Lab is to influence public policy. And by that, I mean that we are focusing on influencing laws, regulations, and administrative actions. And just a quick primer for those of you who are new to thinking about policy work. So laws are really often what we traditionally think of as policy. Laws are passed by a legislative body. This could be Congress, state legislators, but also city councils. And laws range from things like speed limits to Title IX to the Build Back Better Act. We're all pretty familiar with this. But then there are regulations, and these are the formal rules that implement laws. They often require some formal process that includes opportunities for public comment. So I really spent most of my career in this world. I think of this as being where the rubber hits the road. Congress passes a law, but then the president gets to implement the law, and there's a lot of room between what a law says on the books and how it's actually implemented. And Jeremy is going to give an example of the work that we have done in this space. Then there are administrative actions. These are the things that the executive branch can do, but that don't require formal rulemaking. For example, President Biden on day one issued an executive order requiring agencies to take steps to address equity across all of their programs. This included assessments for agencies, creating an equity plan for each agency. And so there are opportunities to influence the issuance of these executive orders, but also how the agencies implement them and the work that the agencies themselves are doing. So I spent some time talking about policy writ large in the Policy Lab. So I want to turn to how behavioral science has been or can be applied to policy goals. For the purposes of today's conversation, I'm going to call these approaches individual, nudges, and systems. But there are lots of other ways I could have broken this out or sliced it, but I think it'll help us talk through some examples. So an individual approach to policymaking is, again, often what we think about when we think about laws. This approach often assumes a rational actor who will be responsive to incentives and punishments. This approach often doesn't think about the context in which people live, and sometimes, this is going to be the appropriate approach. I think speed limits might be an example of that. But as we know, people aren't rational actors. I'm a social psychologist by training, so I'm always thinking about the power of the situation, as we used to say back in the day. So to walk through this, let's take the example of policies around public benefits. So starting in the 1990s with Bill Clinton's plan to end welfare as we know it, policymakers have let their policies be driven by stereotypes and bias about the people who need public benefits like food support, Medicaid, or cash assistance. And they approached this policymaking from this rational actor perspective. If we just incentivize work, we just change the incentives, then people are going to magically find jobs and quit needing the benefits that we're talking about. And so they started implementing these work requirements in various ways. And so requiring people to have jobs or be working towards jobs or in job training programs in order to get certain benefits. Now, despite strong evidence, including evidence from ideas42 that work requirements don't work, policymakers continue to push for these things today. Now, to be clear, there are lots of false assumptions and problematic beliefs that drive this particular solution. But at its core, it's trying to change individual behavior through the use of incentives without regard to the context in which people are living. Then we start seeing a shift in academia with the emergence of behavioral economics and recognition that we are not all rational actors. And policymakers start paying attention to this. And one of the ways policymakers start paying attention to this is implementing nudges. And so we see this shift to defaults, for example, that allow employers to move to opt out rather than opt in systems for health insurance or retirement savings. And this does a good job of making sure people actually sign up for their health insurance or start putting money into their 401ks. For public benefits, policymakers start pushing for what we call a no wrong door approach. So for example, under the ACA, if you applied for health insurance, you were supposed to be directed to the right benefit program for you, regardless of where you applied. So if you walked in and you applied for Medicaid, but it turned out you weren't eligible for Medicaid, all of your information was supposed to go into the exchanges where you could purchase private insurance with subsidies. And it was supposed to work the other way as well. The ultimate goal was for people who applied for one benefit to be able to be screened for any benefits. So if you walked in and you applied for Medicaid, at the same time, that information should also help you see if you were eligible for SNAP or other forms of cash assistance. This comes from an understanding that the barriers and cost to applying for these programs is high. And even though our hypothetical, unencumbered, rational actor would do a cost-benefit analysis and overcome those burdens, in reality, we know that that's not really how people operate. So if we want people to get the benefits that they need, then we need to create a program that meets them where they are. And it's in this space where a lot of behavioral science and policy work has been sitting. And this is really, really important work. But the focus still remains on the individual and shaping individual behavior. So we're going to get people to enroll in their 401ks, but we aren't redesigning our retirement system so that it works for people who are living in poverty. So I will grant I am not as ambitious to say that ideas42 is going to completely upend the retirement system, but we are going to look for systems change. We need to do more than just nudge. We need to change the context. In our benefits example, we know that scarcity is the driving problem. When people don't have enough money, it's hard to focus on other things. Complicated benefit systems might give people more of a specific resource, but they also add to the time scarcity that people living in poverty experience. So I've called our solution, our policy outcome here, guaranteed income. But what I mean is we want to move towards a system that gives people unrestricted cash benefits in some way. Unrestricted cash benefits reduce scarcity and let people use the benefits that they get for the things that they need without having to do kind of complicated mental calculations. And Amanda is going to talk a little bit more about the ways we have been advocating for this. And now I am going to turn it over to Jeremy.
Thanks so much, Kelly. Really helpful description. And yes, as you said, I'm going to now go into a specific example of how ideas42's work has contributed to the debate around and intended to shift both, defaults and then systems when it comes to a specific regulation, the public charge rule. So a little more background on what the public charge rule is. Immigration law since the 1880s has said that if a government official deems an immigrant primarily likely to become primarily dependent on the government for subsistence, then that person can be denied entry or can be denied permanent residency. Since 1999, that was a fairly narrow band, and what we're of specific programs that individuals could use. And what we're looking at here is an effort by the Trump administration to expand the types of programs that immigrants, if used, would then jeopardize their immigration status, their permanent residency, or their ability to enter the country. So next slide. This work, just to step back for a second, is coming from the economic justice portfolio at ideas42 and the insight from ourselves and others of our partners that from 2016 to 2019, safety net enrollment across a range of safety net programs were declining substantially. So this was in a time of economic growth, so one would expect there to be some form of decline, but these were quite large declines. And in addition to large declines, they were differentially happening in places where geographically immigrants are more likely to be located, and then amongst ethnic groups such as Latinos that are more likely to have fears around this public charge rule. So in particular, SNAP enrollment declined by 20%, WIC by almost as much. And actually, insurance coverage among children in 2016 was at its highest level in the history of the country, and that since 2016 declined substantially. So 1 million fewer children were enrolled. So we wanted to look at another potential explanation, which is that a driver of this decline was through the effort of the Trump administration to announce and then eventually implement this public charge regulation, which expands the set of safety net programs that could jeopardize an immigrant or their families with use of it, their access to permanent residence. So next slide, please. So this was, within a context of research going back to the 90s. So previous to the 1990s and the welfare reform law, there was no difference in access to programs such as Medicaid for immigrant populations. But as of 1996 and the passage of that law, there were then substantial changes. So there wasn't an assumption that immigrants would be able to access the program. In fact, if immigrants entered the country after 1996, then that meant they would have to have a 5-year bar, wait for 5 years in order to be eligible for the program. And what that led to from research is significant chilling effects. So even if individuals had entered the country previous to that, it led them to fear for their permanent residency and for that of their children. So within another important detail here is that at that time and then now, the vast majority of those who live in families that have non-citizens, their children are US citizens, so therefore eligible without a 5-year bar. However, in that context, they're found very large chilling effects. Now, when the Trump administration decided to enroll or started to announce the program, there was also an analysis that said that a large amount of chilling effects would likely occur. So we wanted to actually use empirical analysis to identify how that happened. So what we did was estimated the causal effect of the public charge rule's announcement on the effect across safety net programs. So that's Medicaid, SNAP, and WIC using data at the county level. We look at counties that had high numbers of non-citizens versus low shares of non-citizens to identify the differential effect right before and after the announcement of the public charge rule to determine the effect on safety net enrollment. So this was unique because one of the administrative burden effects that people know to be out there, but is difficult to identify, is around psychological costs. So the fear that was generated. But because we're focusing in on the change around the announcement, but not the finalization of the rule, we're able to identify the effects specifically of these psychological costs of spreading fear and the chilling effects they generated. So next slide. So what we find is across the board, using the data that we have, the 3 programs, we find differentially bigger declines in child safety net enrollment for areas of the country with higher shares of non-citizen populations. You can see the specific numbers here. If we take these results and we extrapolate them nationwide, we find that this implies that there's a 260,000 child decline in Medicaid enrollment as a result of the announcement of the public charge rule, not its finalization, but just its announcement. For SNAP, it implies 150,000 decrease in child enrollment, and for WIC, about a 30,000 decrease in child enrollment in that program. So next slide. So this continues to be very much a live issue. So this was our analysis up to the announcement of the program, but the rule was finalized in February of 2020. Of course, almost immediately after, there was a public health emergency and the COVID-19 pandemic. So it meant that both immigrant populations were less likely to use the safety net, and for their children, mostly eligible. However, there was a huge increase in need. And so what we're interested to continue to do is to identify the effects. So we've done that here. And what I'm showing you here is just that the media hasn't covered the ending of the public charge rule. So it has been vacated now. So this data you can see here is up to Q1 of 2021, and that's when the Biden administration vacated the rule. So the Trump administration rule no longer applies, but the media covered it at a lower level than all the other changes in the rule here. You see the line is lower in 2021 for the amount of news articles that came out related to this rule. And we're investigating this. So next slide, please. In the context of Minnesota data, they were able to provide us with SNAP enrollment data separately for citizens and non-citizens. And what you can see here is the decline in enrollment differentially for non-citizens. So that means there's a larger decline in enrollment across the pandemic for non-citizens, even though there's greater need, of course, compared to citizens in Minnesota, and that there's no recovery in that difference that occurred after the public charge regulation from the Trump administration was vacated. So that's, you can see in Q1 2021, you have a flat line, meaning that non-citizens remain not engaging with SNAP in the way that they could. So next slide. So overall, what this means is that these research results can translate into policy insights and inform comments that we've done that I'll describe in a second around the public charge. And we found that perceptions matter, certainly. So safety net eligibility has an enormous impact on actual program take-up, and these psychological considerations matter. In addition, young children need more overall protection, right? So for a regulatory change that affects young children, the negative impacts are both for the short term and for the rest of their lives. So it's very clear research that lack of access to health insurance, lack of access to food and nutritional programs lead to long-term negative effects. And then finally, better communication is essential. So most of this is a chilling effect. That is, it isn't necessarily the case that immigrants are eligible, but are ineligible as a result of these programs, yet because there's uncertainty, because there's fear, it means that they tend to avoid the programs. So that's part of the role that behavioral science can play. And we've done that in two contexts as the Biden administration has moved through the regulatory process to change the regulation. ideas42 has provided public comments using our research and others and insights from behavioral science in two phases. So this one was from October 2021. And then next slide. Also, we have engaged April of this year to try to ensure that the insights that we have around behavioral science are incorporated into the new public charge regulation so that communication of what happens and what the eligibility requirements are will be done well and minimize chilling effects in the future rule. So thanks. With that, I'll hand it over to Amanda.
Thanks, Jeremy. So I'm going to talk about another example of our work. This one is similar to Jeremy's in that our policy advocacy comes directly from the work in behavioral science and evidence-based research findings that we did at ideas42 and beyond, but just in a different context. And this is for the child tax credit. So Kelly, we can go to the next slide. So for those of you who may not know, the child tax credit was established in 1997, and I'm just going to walk through its evolution because it lays the ground for why we at the ideas42 Policy Lab were interested in doing advocacy on this issue. So in 1997, the child tax credit was established by a taxpayer relief bill. Essentially how it worked is that eligible families with children and with certain incomes were eligible to receive an about $400 tax credit, and they could use this money however they wanted to pay for rent or food or childcare expenses to help take care of their family. And then if we hit next, we see that from 1997 to as early as 2021, the child tax credit has evolved in multiple ways. Most notably, the actual credit amount has increased several times from its origin of about $400 to $2,000 as recently as 2017. And also the families that were eligible kind of expanded as well. And then if we hit next, we see that during the COVID-19 pandemic, during March of 2021, the Biden administration released its big economic stimulus bill, the American Rescue Plan Act. And within that bill, they extended the child tax credit in two main ways. So first, the credit was increased from its $2,000 amount to $3,000 for children aged 7 to 17, and up to $3,600 for children 6 and under. And then additionally, the child tax credit was no longer disseminated in the form of a tax credit that was given annually. It was given out in monthly cash allowances unless a family opted for it to go back to the original version. And what this meant is that, for example, if I had a child who is age 7 who was eligible to receive a $3,000 child tax credit, I would receive that tax credit in the form of a $250 monthly cash allowance that either went directly to my bank account or I got in the mail via a check. And this version of the child tax credit was extremely effective. It reduced child poverty rates by about 30%. And this led to the fall of 2021, where a lot of proposals were circulating through Congress to extend this extended version of the child tax credit at least through 2025, with advocates also advocating for it to be extended indefinitely. But then if we see next, actually, these proposals fell through with broader negotiations on the Hill. And as a result, the extended version of the child tax credit expired. And in 2022, 27 million children lost some or full access to the benefit, and over 3.4 million children were thrust back into poverty. And so you can see from this evolution that this is a really interesting case where this program has existed since 1997, but there was something about the provisions that were implemented in March of 2021 that made it a really effective policy at reducing child poverty. So we at ideas42 were interested in investigating this extended version from a behavioral lens to look at all of the insights and research that can support why the 2021 version was so much more effective at reducing child poverty. So what we did is we looked at our behavioral insights from previous work that we had done on poverty and the context of living in scarcity. So if you click next, we started with our research report that members of ideas42 released in 2015 called Poverty Interrupted, which we've already talked about a couple times today. And what this did is examined the context of living in chronic scarcity through the lens of behavioral science. Some important, conclusions came out of this that I'm sure many people on this call are familiar with, particularly some key principles that are important when we're designing programs, policies, or products to best account for the context of scarcity and how it affects people's cognitive hardwiring and the ways in which they make decisions. And so the three principles that ideas42 identified that were important were to cut the costs of participation for families, make it super easy to engage. 2, to create slack and wiggle room, build in flexibilities for families who are dealing with a lot. And then 3rd, to empower families and participants and to destigmatize programs that best support them. So next, we applied the insights that we got from Poverty Interrupted directly to the case of the child tax credit. And we identified the specific provisions that were included in the extended version of the child tax credit that furthered the principles that we identified in Poverty Interrupted. So for example, the Biden administration implemented automatic enrollment, and hundreds of thousands of additional children were able to be automatically enrolled into the child tax credit. And this is a really good example of how the extended version cut the costs for families to participate and engage with the child tax credit. So this was a really good thought leadership piece about why the child tax credit's extended version was likely very effective at reducing child poverty, rooted in our behavioral science insights. Then we took it a step further and we translated this directly into concrete policy advocacy. And the Policy Lab drafted a summary report of the most important parts of the extended version of the child tax credit, leveraging our behavioral science insights, and then worked on the ground to recruit behavioral scientists in academia, practitioners, and researchers to sign on if they agreed with what we had to say and what the field of behavioral science had to say about why the extended version of the child tax credit was likely so effective. And so we wrote this letter to Congress, and then we sent it to key leadership on the Hill who were working directly in these negotiations around considering extending the child tax credit. If you go to the next slide, this was pretty effective. We not only got responses from congressional leadership, but also we were in a lot of news media spaces. And I think the positive result was kind of a product of two things. And this is kind of the Policy Lab's dual mission. One, we want to advance behaviorally informed public policies and make sure that policies that are in place are maximally optimized to serve the communities that they're intended to serve. And the child tax credit is a really good example of a program that's been around since 1997, but for some reason its 2021 version was really just so much more effective. And behavioral science had something to say about why that is and had a really important lens to provide to this policy space to demonstrate why the extended version of the child tax credit should continue going forward. But in addition to that, this also is emblematic of a larger whole in the world of policy, that behavioral scientists and behavioral science as a field is not well represented when policies are being designed from the outset or when they're being amended and improved. And we at the Policy Lab are really trying to bridge this gap and provide for policymakers the tools that they need to create behaviorally informed public policies. And the success of the child tax credit and hopefully our continued advocacy on this has really energized us at the Policy Lab to recognize that there is a space for behavioral science and public policy, and that we're going to continue doing what we can to lend a voice to behavioral scientists who have been working on this for decades and will continue on the future, so that we can better ensure that public policies that are created at every level of government are maximally serving the communities that they're intended to serve. And so with that, I will turn it back to Kelly, who will talk a little bit about where we're going from here in the Policy Lab space.
Thanks, Amanda. So I will be brief in talking about what our future holds for the Policy Lab. So we will continue to work on the same pieces and policies that we have been working on, but we also want to make sure we're focusing on areas that are going to be most beneficial and most able to incorporate behavioral science. So we will continue to think about economic security. And by economic security, that includes both these things like working towards guaranteed income or other kind of cash benefits assistance, but also thinking about how is it that we can just help reduce scarcity and make sure that people have the resources that they need. And so another place that we are thinking about is how do we help, are there policies that we can put in place to help people with the lowest incomes and moderate incomes be able to save money and have emergency savings in particular. In addition, we are going to continue our work thinking around access to benefits for all people. And so that's both looking at ways to reduce administrative burden, to make it easier for people to sign up for, get benefits and stay enrolled in benefits, but also continuing to work on the immigration side, making sure that immigrants are similarly able to access benefits and continue to use them. And finally, we're thinking more broadly in a few ways about how is it that we can help ensure policymakers are building behavioral science into the policy as they're doing it. So what are the ways that we can make sure policymakers have the materials available, the research available, access to behavioral scientists in order to start thinking, as Amanda pointed it out, from the beginning when you're doing policy so that you're incorporating that behavioral science at the very beginning. And we're thinking about this at all levels of government, so federal, state, and local. Like, what are the ways that we can make sure we are out there? And so to that end, I'll just note that we are kind of working on both thinking about actually, writing policy, thinking about, both legislation, but also how, are there amendments or changes to existing laws that would be helpful, as well as the regulatory piece. How do we implement the policies? How can states implement policies so that they are advancing equity and making sure people have the access and the resources that they need? And we're also thinking about how is it that we talk about the policies so that we can actually get people interested and ready to move on them, as well as what's the research that we need in order to support the policies, and how do we bring behavioral scientists to the table so that their voices are being heard and they can advocate for policies. This moment, as we all know, is a really, really polarized moment, and people seem to think you're in this camp or that camp, and it's hard to get out of that. And another thing that I think the policy lab and behavioral scientists in particular can bring to the table is an ability to not come from a particular side, right? And to be able to bring the research and the reasoning behind why we're supporting these policies. And so there could be opportunities to help move policy or change agendas in ways that other people might not have the same ability to do. And so we just want to make sure we're bringing people to the table and making that space. Then finally, we will continue to have a series of events for the next over the course of the next year. That we have our first 2 events scheduled coming up in June and July. On June 28th, we will be talking about reducing administrative burden. And on July 26th, breaking the cycle of chronic scarcity. And particularly that we'll be talking about ending things like asset limits and policies that make it harder for people to be able to save money and create the slack that they need. And so we can move to questions.
Great. Thank you so much, Kelly, Amanda, and Jeremy, for providing this overview. As promised, we do have 20 minutes left for questions, so we'll throw it open to everyone in the audience. Go ahead and drop your questions into the Q&A box at the bottom of the screen. While we are waiting, I have a couple questions I can kick it off with. And Kelly, I will direct most of these questions to you as the director of the policy lab, but of course, Jeremy and Amanda, feel free to chime in wherever as well. So Kelly, I actually want to start with something that you closed on. You talked about a lot of the promise of behavioral science in policymaking and how, especially during this kind of polarizing moment, behavioral scientists can offer a different perspective that might rise above this kind of one camp or the other. But I'm curious if you think there are risks to emphasizing behavioral science and policymaking, and if you can walk us through any of those.
Yeah, I mean, I think there are a few risks to both kind of behavioral science and to policymaking. One of the concerns that I want to caution people when we're thinking about how we're bringing behavioral science to doing policy is that those of us who started out as researchers or are researchers, we tend to work in I certainly came from a lab experiments, right? So I would do lab experiments, and then we had this in these very controlled environments, and then we come up with these findings. But translating that, what you did in the lab, or even what you do in these small group, these small settings and experiments, into the real world can be incredibly challenging, right? You don't know exactly how the findings are going to turn out. And so I think that one can just be both a risk that we will have some unintended consequences or things won't work out the way that we want them to, but it's also I don't want to say a risk might not be the right word for this, but behavioral scientists have to also maybe let go of some of the caution that we might have in making recommendations, because if we want to have evidence, and we're, and I say this, I think we said this in the slide, but I'll say this all the time, we want to do evidence-based policy. And that's really important. Evidence, building an evidence base, we want to do things that are going to work. But if we are waiting around to have all the information, we're not going to be able to move things forward. And so it's important for behavioral scientists, as you're thinking about this, to think about how do we take the principles that we're learning about, the things that we understand, and apply that to policymaking, even though we might not have that full set of evidence-based in the direct line that we want. I'll say quickly, one of the other risks that I find around talking about behavioral science, which also relates to this idea of evidence-based, is policymakers also have the potential to use that evidence-based language as a way to block policy, right? You can come in and say, well, the evidence isn't strong enough. We really need these randomized control trials, and you don't have the randomized controlled study, and so that means we can't move forward with that. And I can give you an example actually of how that happened a few years ago. Is what's called the Teen Pregnancy Prevention Program, but is a program run by the federal government that yes, is aimed at preventing pregnancy in young people, but also supports young parents in going to school, and so supports a bunch of programs. And it's actually one of the most well-researched places of government types of programs. And so there's a good evidence base that has been built up. But this actual, when we start getting to building out new programs, you don't have that random control study. And so this fact was used to block what we know were really solid programs, but people use that language of science to kind of advance, to block programs that they didn't like. And so we have to, as we're entering into the space, we have to be thoughtful about how we are, yes, advancing science, and yes, I want to talk about evidence, and I want to talk about research, but doing so in a way that's also respectful and understands that that it can be turned, that it can be used against you.
Great, thank you. Just a reminder to everyone, feel free to drop your questions into the Q&A box. Looks like we have one new one. This is from Landon. Are there any extra networks that the Policy Lab uses to amplify their impact in the social sphere? So, for example, using behavioral insights to combat the chilling effect and misinformation that resulted from the public perception of the bill for access to child health care programs.
I'm sorry, could you repeat the question?
Of course, yeah, sure. The first part is the actual question. Are there any extra networks that the Policy Lab uses to amplify our impact in the social sphere?
Yeah, so hope I'm answering your question. We are working, as I said at the beginning, kind of really trying to work in collaboration with other advocates. And so one of the ways that we seek to both amplify our work and make sure it gets out there is just making sure that we're sharing it across various sets of policy coalitions, and relying on people who have those deeper connections to help push out the policies to coalitions that we might not have access to. At the same time, we are working to support what the coalitions we're working with are doing as well, and so that we're amplifying their work, hopefully, to behavioral science, to behavioral sciences and our more natural network, or kind of natural audience. And so we're doing it in both ways.
And I could just add, Kelly, I know that the question mentioned specifically maybe the public charge. So for example, on the public charge ruling, we developed those the comments as ideas42, but we also utilized the research that Jeremy and others at ideas42 did, integrated them into comments that a broader coalition did that's been working on these issues, and also just signed on to their comments instead of trying to reinvent the wheel. So we're both individually, providing support, but also just supporting the work of additional coalitions who have been in this space for a while, and just kind of plopping in our research findings that can better amplify the messages that they have. So we have been been doing it specifically in the public charge space, and also with the child tax credit, we have also been doing that with coalitions as well.
And just to add and piggyback off that, I think the unique place that Ideas 42 has is this network of behavioral scientists and those who are interested, many of whom are on this call, and then also this growing policy advocacy and policy analysis network, and sort of melding those two, right? So exactly as Amanda said, the focus of our comments and the Biden administration's public charge rule changes, we're trying to integrate those things. So where's our value add? So it's coordinating with them and saying, from a behavioral science perspective, we know that this type of communication needs to be done. We know for the child tax credit that defaults are hugely important. So that means, automatic enrollment was an important reason for why it was so effective. And so I think that's unique. Intersection is where we can make our significant impact.
Yeah, and I'll just quickly add really there, Jeremy, that reminded me that one of the things that happened with the public charge comments is that the American Medical Association picked up used some of our research in their comments. And then when the Biden administration was writing the regulations, they quoted the AMA's comments, but it was citing to our research. And so it shows how, unless Jeremy did, we did not have a lot of direct contact with the AMA, but through working through this coalition, our materials and information and research was available for a huge number of people to pull from, and that helped amplify our work.
Great. Thank you to our full panel for that discussion. That's fantastic. Another reminder, I will say this in between every question to everyone in the audience. Anything on your mind, please feel free to go ahead and drop it into the Q&A box. We've got some time and our panel is happy to answer any questions. I have another one while we are waiting. So the examples that you all have shared have focused largely on the federal level. But states and local governments are obviously also important policymakers within the United States. Do you anticipate doing state or local policy work in the near to medium term future within the Policy Lab scope as well?
Thanks, Mitra. It's a good question. I love to talk about state work and state and local work. It's actually I like regulatory work, and state and local work is one of my favorite places to be. And so we definitely anticipate doing more state and local work. One of the places right now where we are thinking about doing this in some kind of active conversation is around our work on reducing failures to appear in court. And so on the other side and the research side, we have been working on programs that change kind of when people get notices and information that reduces encourages them to be able to show up to court on time. And we have a series of policy recommendations that would come out of that, some of it very directly related to our research, and some things that are a little broader, like letting people choose their court dates. So that way they're not super inconvenient, and making sure people are able to go to courts that are closest to them, kind of a set of things that come more broadly from the set of principles. And so that is actually something that, yes, the federal government could do some things to incentivize it, but really that kind of work is state work. It's state, and that's going to happen at the state and local level. And so we are in conversations with some states and some localities and advocates in those spaces to think about how to translate that research and work into concrete policy recommendations that could be regulations coming from courts, but could also be mandated laws coming from the states.
And I could add a second example of sometimes, even if the federal government wants to act, sometimes they're not always able to get a majority of folks to pass a law. So when I was on the Hill, I was working for the Senate Rules Committee, and we were working specifically on the For the People Act, which was a federal voting rights legislation bill that did not ultimately pass. And as a result, a lot of changes that folks wanted to make were not implemented. But just because that bill failed does not mean that people were not voting and that these problems did not exist, and they manifest most poignantly at the local and state level. And so there's really a need when federal legislation either fails or is insufficient for work to be done at the local and state level that still addresses the problems problems and serves folks in the community, and identifies either within the locality or the state government how we can best continue to advance the public policies that we think are in the public's interest, even if federal legislation is not able to pass.
Great, thank you both. So I have another question. While we also offer up another opportunity to our audience to drop in any questions you might have into the Q&A box. I promise it's not scary. How do we move beyond nudges and, kind of smaller picture behavioral science designs or applications into broader systemic changes within the policy sphere?
That is the big question, right? Of how do we do that? How do we do the work in a way that's going to actually change the systems that we're living with? And again, part of, what I think, well, there's a few things. One is going back to that last value that we had when I was talking about values is to make sure we're centering lived experiences. And so part of doing systems change is listening to people who have the direct experience with the policies that we are talking about. And from that, you can see what are the systems, what is the context that is creating the problems or creating the solutions, right? And so starting with lived experience, and this is again where behavioral science and just being researchers comes into play, because that we can do that from qualitative research and quantitative research and listening to people, and then measuring and thinking about how when we how do we take the messages to change people's minds about the policies that we're talking about, or what is driving the biases and beliefs that are driving the issues. And so we start by taking these lived experiences, and then that helps us identify the points in the system that are really challenging. And so let's go back to the example we had before, as we're thinking about public benefits. So if you're thinking about public benefits from your sitting in the policy space, we're like, okay, well, let's make it easier for people to get benefits. But if you start listening to people, it's yes, benefits. Like, yes, of course, we want to have access to benefits, but really what people need, and this is what came out of some of our research, what people really need are resources, right? They need resources, and you need time, and you need the ability to get the things that you need. And so that speaks to moving towards to changing the system. So what, the benefits, that's not like, yes, help people get benefits, but we actually need to think about what the system change is and move towards some kind of forms of cash assistance. And that can be incremental forms of cash assistance, like the child tax credit, right? That's one of the, it's not a guaranteed income, it's not a basic income, but it's a place where people are getting unrestricted cash benefits that they can use in ways that are most supportive. But then, we can also think about, well, what are the other systems, right, that are problematic? And so, one of the things that's happening with public charge is that people get some of these cash assistance, in particular if you get guaranteed income, which basic incomes, which localities have been offering, that might interfere with your ability to get to change your immigration status. And so again, listening to people with lived experience so that you know what the problems are, then identifying the pressure points in the system that need to have change, and then bringing all of that together with our behavioral science research as we're trying to create new systems so that we're not replicating the problems that we have seen in the past.
Quick addition to that too. I mean, I think that just from the history of behavioral science, so the insights are important across all levels of intervention. But I mean, so my opinion is that there has been more emphasis on that individual level, or the individual level with context, sort of accepting the system as it is, where there is social benefit to be gained, but also, of course, there is benefit to be gained and impact from working to change the system that requires patience, that takes longer, may not occur, of course, like, laws can fail. But over time, being able to intervene on all levels is, I think, the most important for taking behavioral insights and generating social impact. And so, that's why this I think is so great, because it's being able to make sure that Ideas 42 is impacting each level. So, explicitly on the policy side.
Great, thank you both. We've got time for one more question before we wrap today. So this is another question from Landon. Thank you, Landon, for your questions. So after running research on the context, how do you ensure that proposed interventions actually work? As a policy team, are you able to run RCTs considering constraints on direct public policy influence, or and this is a little bit of kind of my editorializing on this, are you mostly drawing from research that has been done by Ideas 42's, program teams, researchers, or other researchers?
I mean, we're doing a few things, right? So we are definitely trying to draw from research that's already existing and the principles that are already out there and what we know around research in order to help design, to think about policy design. In an ideal world, right, we would also get to do follow-up research on, what the effects are of after policies are implemented. But that is incredibly challenging work to be done. And, we are really trying to scale up what we know does work and turn those things into concrete policy recommendations. But we also are trying to use some creative and creative ways to think about how we can do policy research and look at policy outcomes. I'm going to kind of turn it over to Jeremy, maybe to talk about how we've been thinking about using kind of the opportunities of natural experiments.
Yeah, it's a great question, Landon. And so from my perspective, certainly we would love to run RCTs if we could, but you're right that most of the time that's not feasible. So there are contexts, right? Like Oregon health insurance experiment, where, there were too many people who wanted to be on Medicaid. And so there was a decision to randomize who got it. So it can happen. And so that's certainly an effort. But another one is, as Kelly said, states vary a lot in their implementation of these wide range of policies, and COVID has made that even more extreme. So that's one of the areas that we're looking to exploit around administrative burden or access to the safety net. Just lots of differences in how much states have made it easier to access the safety net, for example, and across what groups. So that variation at the state level and then as well at the local level can be used and exploited to estimate the effect of programs. And the overall idea, RCTs, are rigorous and they're easy to explain. I think, we get a lot of that from doing this like quasi-experimental type of evaluation, and that's what we've been focused on. Maybe a little bit harder to explain, but also rigorous, and we do all the statistical analysis to ensure that the estimates that we're getting back are rigorous, and the main benefit is it allows us to answer a broader set of questions. So that's important.
Great, thank you both. I think that is an excellent note to wrap on. There were a couple more questions in the chat, so if we did not get a chance to answer your question live, please feel free to reach out to our policy team directly. We will be following up with all attendees with a recording of this session, contact information for our policy team, as well as links to some of the publications and public comments and other policy actions that we've taken, including public charge and the child tax credit, just so that it's top of mind for each of you. And don't forget to check out our upcoming installments in the Policy for Shared Prosperity series. As Kelly mentioned, the next one will focus on reducing administrative burden, and that is on June 28th. And then on July 26th, we will be taking a look at eliminating resource limits in public assistance programs. So thank you to our panel. Thank you, Kelly, Amanda, Jeremy, for sharing insights and a look at our policy lab with our audience. And thank you to each of you in the audience who are still with us for joining us. And we look forward to seeing you at the next installment of Ideas 42's Policy Lab series on shared prosperity.
Thank you.